It was a different doctor who did my surgery. Nagpa-opera ako pero sana hindi ako nagpa-opera. I wish I didn't do the surgery. That was my initial thinking. Hello, my name is Terry, and I will tell you about my terrible octopus story. Octopus is what I refer to as my eye condition. It isn't the animal I am talking about. Later, I shall tell you why I call it such. This is the first part of the story. Then a second part shall deal with the ordeal of how I dealt with the octopus. I hope you'd stick around and learn from it. I live in a distant Philippine island, and I work as a fisherman. Sometimes during peak seasons, I also teach surfing lessons. So naturally, I spend long days under the sun in my boat or my surfboard. One day, I looked intently at my eyes in the mirror, and I see a bump in the whites of my eye. What could this be? I thought that they'd go away, but they've been here a while, and it seems to be growing. Unti-unti lumalaki. Worried that it might be something infectious or cancerous, I went to see my eye doctor. Mahirap na, diba? The doctor did the eye exam and told me something remarkable that I hardly ever noticed I was doing to my eyes. Nagulat talaga ako. She said there are 5 elements that are working against my eyes. The sun, the wind, the salt in the water, the sand. All these forces have contributed to the development of the bump in your eye. Diyan nagsimula yan bukol. I thought, wait, sabi niya there are 5 elements, and she gave 4. So I asked her, excuse me doctor, but what is the 5th element? I was taken aback when she said, time. The 5th element is time. Prolonged exposure to these forces may predispose you to these growths in your eyes. This yellowish bump in your eye is called Pinguecula. Sometimes it's also referred to as a baby Pterygium kasi mas malaki ang Pterygium. Sabi niya, both Pinguecula and Pterygium are growths on your eye's conjunctiva, dito sa may puti ng mata. Magkaiba lang sila ng kulay and shape, but they are both activated by the same 5 elements. Pinguecula is yellowish and round. Meanwhile, Pterygium is pinkish to reddish, triangular, and has a network of blood vessels. Maugat siya. It can remain small or grow large enough to cover part of the cornea. Pag nangyari yan, matatakpan ng mata mo at lalabo siya. She then showed me a picture of a full-grown Pterygium and said, at this point, it will be called several names including surfer's eye, pugita, or octopus to many locals. I said, okay doc, I can understand why it may be called a surfer's eye, but it seems rather strange why it would be called pugita or octopus. She answered me without hesitation. Terry, there are 3 very big things, and I will tell you why. First, the octopus is also found in the elements that cause Pterygium, the sun, wind, salt, and sand. Andyan yun elements, andyan yun pugita. Second, Pterygium and octopus may both be associated with fishermen. Madami fishermen may pugita. Third, both Pterygium and octopus are fleshy and sticky. Both of them grab onto something and maintain a strong grasp. The mass can cause blurred vision. It may induce astigmatism and then eventually block this hole in your eye. Lalabo na mata mo. This can be worse for people with kissing pterygium. Nakakita ka na ba ng kissing pterygium, Terry? Just imagine one pterygium meeting another pterygium from each opposite corners of your eye. This is how it will look like. The pupil has been covered, and what remains of the cornea is just a slit. Natakpan na halos lahat ng mata. Don't let it grow this far. A pterygium may sit still for decades, and if undisturbed, it just may well remain there just sitting, or it may crawl ever so slowly. Yun iba mabagal talaga lumaki, minsan dekada. Okay, Doc, it's scaring me a little now. However, I just can't help but wonder. Meron ako fishermen and surfer friends whose eyes are fine and not a trace of pugita, kahit pusit wala, Doc. Sorry, Doc. I'm trying to calm my nerves, pero what makes some people more prone to it? Bakit ako meron, pero sila wala? The good doctor, more patient than her patients, continued to explain. She said, while pterygium can arise from risk factors including sun and wind exposure, There may be a number of reasons why some may be more prone. Number 1. Yun iba may lahi sa family. Genetics may play a role in an individual's predisposition. A good hereditary pool may be protecting your eyes from developing pterygium. Number 2. Individual differences in eye sensitivity to UV radiation may also play a part. Sensitive lang talaga yun iba. Some people's eyes are just built to withstand forces of nature that would otherwise cause others' eyes to react. In short, blessed sila. Third reason is an individual's use of protective measures. Some individuals may be taking proactive steps to protect their eyes. Okay, Doc, I see. There are some things that I need to do since my genes and my work increase my risk of getting pugita. Please teach me how to slow down the growth of pterygium in my eye. Paano po gagawin ko? She promptly explained to me 4 very important things, but she said the most important step is to protect my eyes from the elements. She said I must wear polarized sunglasses that block 99 to 100% of ultraviolet rays. Best to buy wraparound styles for better protection from the sides. To give further protection from wind and dust, she said, I must wear a hat or sport an umbrella. Pero masyado ako macho para magpayong Doc. Hehe. Another important thing is to keep my eyes lubricated. I need to use artificial tears to prevent dryness and wash eye surface of irritants. Gawin mo na itong maintenance mo. She also said, smoking can worsen inflammation and irritation, which can accelerate pterygium growth. So it is best to stop smoking or avoid exposure to vape and smoke. She further added that in some cases, surgical removal of the pterygium may be necessary to control its growth and improve vision or aesthetics. But not all who want surgery will get surgery. Oh, I wanted you to remove my baby pterygium, Doc. Is it not advisable? Pterygium removal is generally recommended if it interferes with vision, causes significant discomfort, or is cosmetically undesirable. However, small pterygiums that don't cause problems can be left alone, monitored, and treated with lubricating eye drops. Pag maliit tapos ginalaw natin, mas mabilis na siya babalik and mas makapit na siya because of scarring. It will grow faster than when it was left untouched. I left her clinic feeling somewhat relieved as I was given a prescription, and I promised to myself to follow most of her advice, maybe except the umbrella part. Many years should follow before I had another eye checkup. We moved to another location and wasn't able to see that good doctor again. It was a different doctor who did my surgery. Nagpa-opera ako pero sana hindi ako nagpa-opera. I wish I didn't do the surgery. That was my initial thinking. Watch out for the continuation of my octopus story. Thank you for sticking around.